Hey everybody, my name is Rebecca Scroggy. I am a registered nurse and an IBCLC, but probably most importantly, I am a mom to two kids. I am so beyond thrilled to be here with you and share some amazing superstar interviews with you all. We will be going over amazing topics like lactation, postpartum mental health, pelvic floor, and so much more. Just to make sure you don't miss anything, make sure to hit subscribe and follow us on all of our socials. We'll link them below. And as always, we want to know what you want to hear. So comment below any topics that you'd like us to cover. So now that we got that over with, here we go. I am so excited about this.
Yeah, so I'm Candace. I hold a Master of Public Health, and I'm also a CLC. But most importantly, I am a mom of a weanling. So I have breastfed myself, and I'm really grateful to have had that experience and very privileged to have been able to do that. So way back in 2016, I graduated from Boston University School of Public Health. That's when I got my master's degree. Before that, I had worked in a hospital setting, doing kind of like administrative things. And that's when I decided, after working with different healthcare providers, they were like, wow, you're really passionate about some of these systems issues that are broken in our healthcare system. Why don't you go into public health? So that's how I ended up in the
I love
field.
that. I love that.
So after getting my degree, I worked as a epidemiologist in a rural New Hampshire public health region. Every state has very different setups. After becoming a mom, a lot of systems issues that and barriers that we face with breastfeeding really smacked me in the face. And we had a very, very rough start to breastfeeding. And that's when I kind of had that aha moment of, I started diving deeper into, baby sleep, feeding, all of these things really are interconnected with maternal and parental mental health, which is kind of how I came, stumbled into this space online, just being a voice, kind of a bridge between some of the more holistic things that you see out there, and, public health. This right? Is hard because, a lot of things are basically set up to work against us, and we are defying the odds being able to do anything in a way that is supportive of our children's, overall health. So,
I mean, and you're not alone in that. There's so many lactation professionals that became a lactation professional because of their own journeys, and their own hardships that they went through. So, I would love to see all healthcare professionals that have some sort of contact with moms and babies have breastfeeding, even like super basic breastfeeding education would be great.
Totally agree.
I know I talked to pediatricians that they got like maybe 2 hours of breastfeeding education through their medical trainings. Is breastfeeding considered a public health issue rather than just like a I want to breastfeed kind of thing?
Yeah, it's so important to talk about this because I think a lot of folks, first, I'm just going to define public health, and they just say that public health is the science of protecting the safety and improving the health outcomes of communities through education, policymaking, and research of disease and injury prevention. So breastfeeding as a matter of public health, obviously, has so many known protective health benefits for infants and the parent who is lactating. Really, breast milk is one of the most effective ways to ensure adequate nutrition. It meets all of the needs that a baby has for their nutritional, for growth and adequate, nutrition. It has various immunological benefits. It contains essential nutrients that, obviously kind of goes along with the nutritional aspects of it. The privilege of being able to directly feed from the breast. There's also added benefits of safety because there's minimal, almost 0% chance of risk of infection due to contamination. It's like the cleanest way that we can provide food for our babies. Breast milk even if it's expressed, is still extremely beneficial for child's overall health and well-being.
And if you can breastfeed your baby, even just a little bit, that's going to help protect, against allergies, against asthma. And then I also used to work in a pediatric ER. So I was like, you don't want your kid at 2 o'clock in the morning on a breathing treatment because of allergies. So if you can do any type of protection against that, even just a little bit of breastfeeding is better than nothing.
Were separate from you or they got into something, just because, separation can just be they were crawling around on the ground and picked something up and put something in their mouth, right? That we wouldn't have got something because we don't put toys in our mouth when we're at the library or books in our mouth, right? But there's actually an immune exchange that happens directly in the breast. I know but I think it's like one of the coolest things about breastfeeding, because it's like a micro kind of immunology kind of environment there. So if a baby is getting sick or exposed to something, your body will then create some antibodies, even though you weren't exposed to it any other way except for through your child nursing on you. So that is so cool.
And that's so cool. Yeah. I always tell my parents, because I always hear from exclusive pumpers, like that's one of the things they're like, how do I do that? Do I just like rub their saliva on my boobs? Like, how do I do that? And I was like, well, you can, but you're going to get some of that, like picking up their bacterial and stuff like that by kissing on them and skin to skin. So like, I think it gives me chills. Like I literally have chills right now. Just thinking of like what the human body can do to like help protect babies is just, it's crazy. How does it contribute to overall population health? Because I mean, that's a little different than just like public health. It's like overall your community. How can that help with that?
Yeah, that's a really good question as well. So population health can sometimes be defined in a couple of different ways, but usually when people are talking about it, it's like the population of like a given area that you're kind of focused on. So if we can increase breastfeeding rates, or, children that are given express breast milk, in a given area, that has so many benefits for your local healthcare system, because it helps reduce burden of disease, therefore less doctor's visits and all of that. There's going to be higher IQ, which, as we all know, increased levels of educational attainment and all of that. It's easier to attain higher levels of education with a higher IQ, and higher levels of education tend to lead to better overall life outcomes, in terms of health, wealth, well-being, as well as lower rates of infant mortality. And that is a very interesting topic that they're looking into more, besides all the immunological benefits we talked about before, which are clearly protective of SIDS. There's also a potential like biofeedback happening in terms of wakefulness in breastfeeding, that it might be protective just for the sheer fact that the child is waking so often to feed. They're not getting into too deep of a sleep, which could be harmful for very young infants, which again is like totally contrary to what you're taught. We're supposed to be having our baby sleep through the night, right?
Yeah.
They're not supposed to bother you.
At the age of like 6 weeks. Exactly. So like that's so important, because like we hear as moms from everyone, how's the baby sleeping? How's the baby doing? Like, is the baby sleeping through the night? It's never like, hey mom, how are you doing? How's life changing for you? Do you need any help? It's always, is the baby a good baby? Are they sleeping through the night? Like, that's always the first question.
I know. Drives me bonkers.
I know, me too. So I really like how you talked about that, of like, it is important for babies to wake through the night, and it's protective against, different things. So I can't wait to see more of that research coming out. That's really exciting.
Oh, one more thing, actually, in terms of population level health, breastfeeding and being able to provide, breast milk for your child is actually also a very great emergency preparedness, just element in your toolbox, because as we know, with the way in which the climate is kind of looking. Things, we're seeing more extreme weather events, and
Yeah.
people, it affects supply chains, especially with how a lot of corporations operate now, where things are really centralized. And, just for example, if you look at Asheville, how they got
Yeah.
slammed somewhere that totally is not somewhere you would think would get hit by a hurricane, so bad as it
Yeah.
was. They have one of the top distribution plants for and production plants of IV fluids, 60%
Yes.
in the US. And I know that's one specific example, but that happens with things like formula and other, and that is related, because if your child is getting sick, they might not be able
Yeah.
to access IV fluids. There were some hospitals that were even saying like, oh, give like Pedialyte or Gatorade or whatnot
Oh,
before you
yeah.
try to come in,
Yeah.
whereas they normally would have wanted families to be
Yeah.
coming in, just because that's how bad it was. So that's
Yeah.
another really important element of, if we can increase breastfeeding rates in a,
Yeah.
profound way that actually
Yeah.
supports families, that would
Yeah,
be
no, that's like
really great.
that's so important. I actually just did an interview with Love Anderson from the Western North Carolina Breastfeeding Coalition about safe infant feeding, and it was so amazing to hear like how, during an emergency, you don't have to grab anything if you're breastfeeding. It's literally on you, like your boobs are on you, so you just
Mm-hmm.
grab your baby and go.
Mm-hmm.
Um, and like how beneficial that can be in an emergency, because you're right, you don't have to have electricity, you don't have to have, formula, you just go and there
Mm-hmm.
you go. You
We don't
have
have
it.
to, yeah, we don't even have to have like adequate nutrition to be able to still
Yeah,
provide perfect
yeah.
milk for
Breast
the
milk.
baby.
Yeah. Systems and like reduce overall medical costs.
Yeah, that's another really great question. There's obvious, like I said, reduced likelihood of illnesses, and that's going to lead to reduced burden on the medical system. So not even just the burden on the medical system, but costs for you as the parent, as we know, living in this country. It is quite outrageous, how much we are spending just for a sick visit, never mind a hospital admission, never mind if you need all sorts of extensive procedures. For example, if you're like getting ear infections, I've seen people really dismiss, the whole ear infection aspect of it, but in terms of protection, because I have seen firsthand many of my, folks that I know, it's never just an ear infection. They always end up needing like all these subsequent interventions after, which is uncomfortable for your child and scary. You have to wait, they're in pain. And again, it costs a lot. So there's that. In terms of the healthcare system costs and savings, it's saving all sorts of administrative costs for hospitals for storing and managing, ensuring that they have the correct, expiration dates on, their formula if they were having it in the hospital. Um, yeah, and saving you as a consumer again on like the cost of medications or inhalers, things like that, because you had mentioned asthma before.
Yeah.
I did find there was a study that actually looked up, and I know that you're going to post stuff, so I'm not going to get into details, but it was
Yeah.
in the UK, and
Hmm.
they were comparing medical costs for just primary care consultations for formula fed versus breastfed babies, and the cost savings was pretty
Yeah,
interesting.
absolutely. And like not even just the cost of the medications, but like the cost of being out of work
Yeah.
and childcare. Like that's a lot. Like we live in a country now and in a society where most families are having to be dual incomes. And so, most
Mm-hmm.
often it's the mom that's having to take off and her job is at risk.
Mm-hmm.
To go take the kids to the doctor or the hospital. And hospitals are even worse because you have days where you're in a hospital that you
Mm-hmm.
can't go to work too.
I know. And then
So
you're like having to
it's
pay to
expensive.
go down to the cafeteria,
Yeah.
and that's like always
Yeah.
so expensive. And
And it's never
God
really
forbid you have
great
another
food.
kid
Yeah.
too.
Yeah.
Like
And if you
have,
have another
oh
kid
my
too.
gosh.
Yeah. Okay, so what are some environmental benefits of breastfeeding compared to formula feeding?
Sure. So I think that is like one of the most obvious is that you don't have to produce anything. There's no, worrying about, sourcing of materials that could be perhaps unsustainable. Obviously, a lot of packaging is not great. That's another whole thing that we have to worry about. So I don't know if you are aware, but in the United States, we have like a really huge landfill issue. I know in my state in New Hampshire, like in the next 5 years, we have no space left for our trash. And people are all of a sudden like, wow, what do we do? So it's not radical to think that we need to start thinking in more sustainable ways. And I don't think the onus should be on like parents to be like, oh, shame them into making a decision about how they feed their infant. It's how do we create systems that make it easier for parents to be able to just breastfeed, and putting the onus on formula companies to make more sustainable packaging that is safe in some way, which I'm not a like engineer, so I cannot tell you like how to make that. I'm not a product scientist, so I can't tell you how to do that, but it's a huge problem. And then so I believe it was NHS, they made an estimate where if it's one parent is choosing to breastfeed, it's like taking 75,000 cars off of the road in the UK per year. So that's pretty significant in terms of like that's going into the production and the I think it's like cradle to grave estimate of like resource and energy use for dealing with the trash then after of formula packaging. So that is something to consider. And again, I sometimes don't love having to like put the onus on a person. I don't like when it's making a person feel a certain way, but I want this to be more so like policymakers to understand just how significant of a difference we can make by having some policies that support and promote, protect breastfeeding, as opposed to putting profits over people.
And I've never I've never thought about that of like how the formula cans, like once you're done with them, they just go, I mean, because I don't think they're recyclable.
They're not, because they're kind of like that coating. It's like a waxy coating on the outside. It's usually that like metallic kind of interior. So I don't really think that it can go anywhere but the trash.
How does breastfeeding support that food security, especially when we're talking about like vulnerable communities that are like low income or, maybe have to go back to work 2 weeks postpartum or, that kind of stuff, like, or they have no support, how does that support that?
That is really, it's so complex. So food insecurity, for folks who don't know what it is, it's just defined by inconsistent access to enough food to like lead a healthy, active life. And this can be anywhere from having a reduced quality and quantity or variety of food all the way to like they're skipping meals and stretching food out. So just for context, this was a couple of years ago, and I bet it is way worse now, but 13% of households in the United States fit into that definition of food insecure. So if a family is able to breastfeed and experiencing food insecurity, the lactating parent's diet, as I mentioned before, it doesn't affect the ability to breastfeed completely. There have been studies looking at folks that live in, very extreme poverty, and the parents are literally malnourished. And this is really sad that we have this information, but they're still able to, as long as they have enough access to water, they're able to still breastfeed fully their child, and their child is perfectly healthy. The bad thing is it affects, obviously, it's taking from you. So you're even more depleted as a parent. So there's a lot of factors that will make it even harder for if you're experiencing food insecurity or have trouble accessing food. So this would be like a food desert. I'm not sure if people have heard of this, but it's basically, within a certain radius, you are not able to get to like a grocery store. Like it's not easy to get to a place that has like solid food options, not just like a quick mart where it's got a bunch of ultra processed foods that are kind of nutrient deficient and all of that. So obviously there's a lot of things in play,
Yeah.
but if we could reduce our reliance on unreliable supply chains for, things like
Mm-hmm.
formula, it is, a net benefit for folks who are experiencing food insecurity. But obviously, it's just like so much more complex
Yeah.
than
Yeah.
like, yeah, like theoretically it is great.
Mm-hmm.
It's just how are we going to not only fix that problem, but make it actually possible that folks who live in these conditions would actually be able to achieve the end goal of being able to breastfeed, right?
Yeah,
So
yeah. Well, and like just talking about that, like the complex of it, of like, people think formula is food security because you can go get it from the grocery.
right.
But as we saw with the formula shortage, that's not always the case. And then you're
Mm-hmm.
stuck with traveling for hours to go find a formula. I mean, I've heard stories of like dads going and standing in the formula aisle being like, I
Mm-hmm.
drove 2 hours to come and pick up a can of formula and it's not here. Like, what do I do? And that's kind of that food security of like, it's not
Yes.
always secure by going
No.
through formula, unfortunately, which is really sad and scary.
And I've seen some really scary things like on like Facebook groups where people are like selling cut formula. And that's the other thing is
Yeah.
with food security is folks think, okay, well, I can ration the formula like I ration and cut it with more water and ration
Mhm.
it like I do with my meals. But you can't do that with formula. That's like the thing
Yeah.
that's really scary is that, not only is it the child not getting what they need, which I'm sure the parent knows, but it's really unsafe for babies to get too much water.
Yeah.
They can
Yeah.
have water intoxication, which is something
Yeah.
that I think a lot of people don't realize. Um,
Yeah.
so,
Well, and I'm sure, me looking on the bright side of all the things, but I'm sure parents who are trying to cut it are not necessarily thinking that this is going to hurt my baby, but
no, no,
they're
no, 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 no.
thinking like in the long term, they get more food kind of
Right,
thing.
right,
Yeah,
right,
yeah.
right.
And it's
Yeah, yeah,
just,
yeah.
they don't
No,
know. And if you don't
right.
know, how can you do better kind of thing? I mean, that's not on them at all.
No, and that's like a whole other topic that I,
Yeah.
have talked about that I think it's not only should formula be free,
Yeah.
but parents need, even if they're intending on breastfeeding, I think
Mhm.
baseline period all parents need to get educated on how to properly prepare,
Yeah.
store, handle, and everything about formula. And that
Yeah.
doesn't mean you're promoting it. It just
This actually is a really good segue into the next question because, we talk about education, but like, what are the biggest challenges that parents face when they're trying to breastfeed? And that is such a loaded question. So
yeah.
sorry.
Well, no, I mean over way more than over half of parents in the U.S., according to the CDC, I think it's 60%, don't breastfeed as long as they wish to. And there's so many reasons. A lot of them, unfortunately, are surrounding lack of adequate lactation care because they give up
Yeah.
because they don't think they have enough milk, which
Yeah.
not diminishing people who actually experience low milk supply or
Yeah.
cannot produce milk because that happens. Um,
Yeah.
it's just not as common as I think kind of talked
Yeah.
about. You know what I mean?
Yeah.
So I wish that more parents could have access to adequate support to know that, you know, you're not going to be like a statue necessarily where you're shooting out
Yeah.
milk everywhere. Your body generally, if you're, offering the breast regularly, very often, you're going to produce exactly what your baby needs.
Yeah.
So they also have issues with latch. There's issue with pain. That was me forever, and it was terrible. I'm just super stubborn, but not everybody is stubborn. Um,
Yeah.
but another big one is that people have to go to work, people have to go to
Hmm.
school, and that is like the biggest. It's around like 10 to 12 weeks is like where you see the biggest drop in breastfeeding rates.
Yeah.
Because in the U.S. that's the some employers, it's some
Yeah.
states offer some protections in terms of, I know in my state of New Hampshire you're only
Hmm.
protected in terms of you won't lose your job. It doesn't mean
Yeah.
that you're going to have the same role, but you're not going to
Yeah.
lose your employment. So there's like that
Yeah.
fine print that you could technically lose the role that you had. Um,
Yeah.
we're not going to pay you unless your employer decides to do some sort of FMLA or what have you, program, or do something above and beyond. So a lot of people end up having to go back sooner, because I know, again, like, I had prepared for this, and I still couldn't have, like, prepared financial, like, by the time I had to get back to work, I was like, thank God, because I have, like, nothing left between paying for the mortgage.
A public hospital that we saw a lot of low income. But I mean, I had talked to many families who were like, I want to formula feed and breastfeed because I want them to have the immune benefits, but I have to go back to work in 4 weeks and I want to make sure they can take formula when I'm back to work. And I would talk about, well, you could pump at work, there's protections in place for that. And they were like, yeah, but I don't want to risk my job, so I don't want to do that. I don't want to talk to my employer about my pumping, rights or anything like that because I don't want to risk anything. And that's a really real fear for so many people of like, even if there are protections in place, the stigma behind it, or, the time out of your job where maybe you have to like miss meetings or miss hours,
And project opportunities, things like
yeah,
that.
yeah.
There's different types of work too, where if you're like in, for example, like a more of a factory type setting,
Hmm.
or something out in the field, it's hard for you to be able to have like the flexibility to go into a separate pumping room. Like,
Yeah.
there are not many
There's,
employers that have
yeah,
that.
yeah.
Um, Nor do they support it. And unfortunately, there really is a motherhood penalty, because just like, it's tough, right? It's there's a lot of
Yeah.
things that can kind of be sneaky ways of not being very supportive for parents. So I get why they would choose not to want to do
Yeah,
that. And some people are just
absolutely.
seriously uncomfortable talking about it, too,
Yeah,
because it is a
yeah,
little awkward to be like,
yeah,
I have to go milk
exactly.
myself like a
Yeah,
cow. Um, so, and it shouldn't be that way. I like
yeah.
made it a mission to make my boss very uncomfortable, because he decided to reach out to me during my maternity leave. And
Oh,
I made a
nice.
comment about my bloody nipples, because I was just, because he said, like, how's your vacation? And I just about lost it. Yeah, he never ever asked again about anything related to my child. Honestly, after that, because he
Oh,
was so embarrassed. But not everybody is as shameless as I.
no, but
I
that's
was
such a
so
good
mad.
point because I
Uh,
mean, like, back in the 50s, women weren't in the workforce even like 30, 40 years ago as they are today.
no.
And so, like, a lot of older managers or supervisors just don't understand
Mm-mm.
or get what is needed to be pumping in the workplace. And women have worked really hard to be where we are in the
Mm-hmm.
spaces that we're in. And so, I'm all for let's do it. Let's talk about our bloody nipples.
I know,
Do
which
it.
I'm mad that
Absolutely. Which is just like goes to show that like even if you want to and you may be not as successful with meeting your goals, don't take that blame on yourself because there's
Mm-mm.
so much at play. It's not as simple of I want to, so I'm going to. Like that's
Mm-hmm.
not always the simple answer to when it comes to breastfeeding. I mean,
Mm-mm.
breastfeeding is a natural thing that's biological, but if you've never seen anybody do it, if you don't
Right.
know how to do it, then it's not your fault for not being successful at it.
Oh my gosh, yes. So much that.
Yeah.
I could go on a
So
whole
like
tangent on that
I
if you
know.
want
I
me
know.
to. Uh, I mean, just the way in which specifically our country is set up, we have destroyed community. We have no
Yeah.
community. And
Yeah.
I know for me, I had only seen one person breastfeed in real life, like in my family
Yeah.
unit. Um,
Yeah.
and that makes a difference. We're supposed to have a whole bunch of people we have been seeing since we were kids,
Mm.
all the, folks around us breastfeeding. And if someone couldn't, someone was stepping up and breastfeeding
Yeah.
for them. Like, there was
Yeah.
just so much more, it was just normalized, right? It was just a part
Yeah.
of how we existed. And if you didn't know what to do, there was someone that was going to come over and teach you how to do it and help
Yeah.
manage. And it's, everything has been, turned into a way to make money. And I hate when, um, I don't want to say it in a negative way, because unfortunately I've seen formula companies attack
Yeah.
lactation professionals, saying, oh, they're just trying to make money off of breastfeeding, when it's like, pot meat kettle.
Yeah.
What? Uh,
Can guarantee I do not make as much money
um,
as a formula company
right,
makes.
right. It's sad that we have to live in a society like this, but
Yeah.
you people who are dedicated to doing this work, you don't make enough for what you have to
Yeah.
do. You know, if that's
Yeah.
like your sole work, you have to work with so many patients. It's just sad that we've been stripped of that access to just regular community. And it's lovely that there are like groups and whatnot, like
Yeah.
breastfeeding groups, which are, I think, so important. But again, in the past 5 years, so many of these things have eroded because of the pandemic and just
Yeah.
even further hyper individualization and isolation.
Yeah.
Again, no fault of anyone specifically. It just,
Yeah.
you know,
I know when I was going through with my first, which I mean, he was born in 2019. So he was like a year when COVID hit.
mm-hmm,
So a lot of my community came from online communities like Facebook groups.
mm-hmm,
And I am still friends with some of those women that
mm-hmm.
I've never actually met
Right.
because, we're all just online. And it's similar, but it's not the same thing as in person.
Mm-hmm,
But you still get at least some of that community of
mm-hmm.
like, you know, talking with people that are in similar stages of life as you and being like, this sucks. And then they're like, yeah,
Right.
this does suck. And then you don't feel as bad.
Right. No, and it is like it's so beautiful we've been able to find a way,
Yeah.
like how resilient are we to be able to figure out how to do that? It's
Yeah.
really
And I
important. I
mean,
don't want
I'm not going to give all the perks to social media because I don't know how many clients that I have that are like, I'm not pumping enough milk because they see women who are pumping 12 plus ounces at a
to.
time.
Yeah.
So they think that they have low milk supply because they're not making that much milk. So, I mean, I give and take when it comes to social media
Yeah.
because it is good in some ways,
I
but in
know.
other ways,
I'm like, don't freak out. That's literally could be almost half of what your baby needs in a day.
how do systemic inequalities like race, income, access to healthcare, which again is very commonly seen in like low income areas,
Mm-hmm.
and a lot of times it's the African American communities
Mm-hmm.
or, immigrant communities that are struggling in this aspect. But how does that impact breastfeeding rates?
For sure. That is, there's so many like different intersections of issues that kind of create an environment. I feel like I talked about some of these already, but there's also the whole element of how formula is marketed and how it was marketed. It is kind of sadly rooted in racism in terms of how formula companies basically buy, well, not necessarily started, but like they started to target the global south and touting that their product was like so much safer than breast milk and all of that, and that it was better for their kids, they were going to be smarter and all of that, and that's kind of what spurred a lot of what we see today. Obviously, the international code
Yeah.
of marketing of breast milk substitutes, which
Yeah.
it all ties together because there are countries that have adopted legislation based on this code because they saw the data that showed how this marketing detrimentally affected and led to very adverse health outcomes and in some instances losses of babies in these countries, and how aggressive these campaigns were, that we needed to rein in how we talk about breast milk substitutes. And unfortunately, in the US, we refuse to create legislation because there is we allow for lobbying, we allow for money in politics. Formula companies have a huge lobby. They, unfortunately, except for one that I know of, often advocate against paid leave policies. They unfortunately will target low income communities in terms of where they put up advertising. Um, they're very shady, unfortunately, with, if you sign up for some sort of something like baby list online, um,
Yeah.
or, one of those sites, they'll get your address and they start sending mail samples to
Yeah.
families. And if you are not aware, which, even if they do that kind of across the board, there are folks that, if you have a lot of support, you have a community that you have health care, you have a higher income bracket, you'll get that sample and you're like, I don't need that because I feel confident in my decision. But if you are struggling to put food on the table, there are going to be communities that when they get this, they're going to see it as a gift. They're going to see it as they care about me. Those lactation professionals don't. So there's like a lot of like subversive, honestly, like attacks on lactation, which negatively impact the lowest income communities. And like you said, in communities of color, there's just like I said, a storied history of, unfortunately, formula companies kind of pushing this in certain demographic groups. And unfortunately, because of a lack of regulation here in the United States, and lack of really robust policy to support increased breastfeeding rates in our country, we really just are hoping that businesses are going to be altruistic with a lack of regulation, which we know never happens. And it's about to get worse now, unfortunately. So and then in low income communities, you can't, there's often fewer healthcare institutions. There's going to be less private practices, less qualified lactation staff. No shade at all. WIC is so important. They do really great work. From what I understand, though, they only provide like some of the kind of basic level kind of lactation professional it's just like, what is it? Do you remember what the it's
designated?
Not even,
it's a designated breastfeeding expert. So
usually so it's not necessarily an IBCLC.
Not necessarily. So, it doesn't have to be.
And it's again, that is it's a great first step. It would just be lovely if we could get more robust support for higher level qualified lactation professionals that can support some of the complexities of that breastfeeding dyad and the breastfeeding experience, that can really sit down and write plans for, we're gonna, this is how you can do it, given your work, your work environment, like we're gonna do this, that, and the other, like I'll help you draft XYZ. Like there's so many things I wish that we could do.
I know.
But anyway, it's just like, because there's the lack of funding, there's a lack of everything. That's kind of, it's a complex mix of things that just really work against folks having successful breastfeeding experiences in these systemically and traditionally disenfranchised communities across the country. And never mind folks who are in like the LGBTQ plus kind of group. They often feel like they're not able to receive the care that they need, so they will not even try to initiate breastfeeding just for lack of they feel like people feeling like they're going to be accepted in doing that, and what people will say and all that, and it's none of their business, but they should. We have a lot of work to do to better support everyone.
Well, and I know that there's so many like private practice lactation professionals that would love to help these people. But you said earlier, like in order to have a living wage, you have to get paid. And unfortunately, in many states, Medicaid does not pay for lactation care. And so, that's a whole nother piece of that systemic policy based, and then the low income folks can't afford a self-pay for lactation care. And then you have a lactation care desert in these areas because, they can't afford to stay in that area if no one's going to able to pay for them. And that doesn't even count like the rural areas where there is nobody who is lactation. Or if there is, they're traveling 1 to 2 hours to go, and that cuts into their living wage because that's 2 hours they could have seen somebody or, whatever, what have you. So, I mean, it's one thing that I hope that our viewers get from this conversation. It is not just one thing that impacts how breastfeeding is interactive with public health. It is so complex. going back to work early can really impact breastfeeding rates. And, how do we combat that? Paid parental leave, right? I mean, that's
Yeah,
really the only way to do that.
for sure. And, there are other countries where, because again, formula marketing is so aggressive that, sometimes folks are like, oh, well, the breastfeeding rates aren't that much better in these countries. But they are sustained for
Hmm.
longer. Like those who initiate are able to continue, um, you know, for the duration that they're hoping usually to breastfeed for. So it plays such a huge role because you have that protected time to be in the dyad with your child, to figure out this new relationship, to figure out how to feed your child without putting your family in undue financial hardship. If you are super, 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 super stressed, which finances can cause like insane amounts of stress, that can impact your supply.
Yeah.
So there's an actual interaction there. So if we can protect
Yeah.
pay and have access to, um, and along with paid leave, typically if there is paid leave, you have some sort of healthcare coverage so you can access, more technical support
Yeah.
during that period. And you don't have to worry about, if you can pay your bills, you don't have to worry about rushing back to work.
Yeah.
They're able to meet the goals that they set out to, meet from the
One
get-go.
time going and getting my nails done, and my nail artist, she found out I was a lactation consultant. So of course she's talking to me about
Yeah.
that. And I have a face that people just like to talk to me. So, we're talking and she's like, yeah, I had a C-section with my last baby and had to be doing people's nails 2 weeks postpartum. And she's like, so
Mm,
I just didn't even try to breastfeed. And I'm like, because she works at a position that if she does not work, she does not get paid. As
right.
a small business owner, there is no such thing as paid parental leave
Exactly.
because and there's so many people who do hair or nails or
Mm-hmm.
childcare. Like if you have an in-home daycare or something like that, if you don't see kids, if you don't do your work, you don't get paid for it.
Mm-hmm.
um, which is huge. And like the paid in that breastfeeding success, I mean, we talk about, I usually tell my clients, like, give yourself at least a good 2 weeks to learn your
Mm-hmm.
breast pump and be comfortable with that before you go back
Mm-hmm.
to work. But if you're going back to work 2 weeks postpartum, when are you supposed to do that?
Right. No, and I totally, yeah. And actually, thank you for bringing that up because that's a huge reason why we need a nationwide
Hmm.
paid leave, something that is a pooled
Yeah.
kind of resource for parents to be able to tap into. You can't just, put it back on the employer. Not everybody works for a big company
Yeah.
that can absorb those types of costs. And what folks fail to recognize is that healthy children, healthy families is how we have a healthier, more robust economy. We have bright spots. We have,
Mhm.
other countries that do this where you can see just how much better off
Yeah.
everybody is, health wise, well-being wise, happiness wise, when you look at
Yeah.
happiness scales,
Well, I
which
mean,
I
like just in the public health standpoint, like if you are not happy, you're most likely sad, depressed, or stressed, or all three. And we
mm-hmm,
know, like in a healthcare wise, stress and depression impact your overall health, which
mm-hmm.
puts a higher strain on, the healthcare system.
Oh
And,
yeah.
that definitely, I'm going to say happiness does play a part in health. Things that public health initiatives that have improved breastfeeding rates and maybe some that you love or something like that.
Yeah, of course. So, well, WIC I talked about, that is a
Mhm.
pretty good example of
Lovely.
breastfeeding promotion and support initiative in
Yeah.
our country. It has, the USDA has some figures about um, how it has led to reduction in infant mortality, improved infant
Mm.
growth, medical cost savings, better diets, better overall health outcomes for infants involved in their programs. And I love to hear it. There is the Baby Friendly Health Hospital initiative, which this is an international initiative, which you know of, which
Yeah.
they came up with 10 steps to successful breastfeeding. And there's some they've expanded upon it over time to include process and outcome metrics and different things for if you're a hospital that wants to be a baby-friendly hospital, that you are, meeting certain, you're doing, specific things to show that you are in compliance with that standard. I believe last I checked, it was like 600 hospitals in the U.S. are baby-friendly hospitals. There have been, as per the WHO, they looked at systematic review of 58 different studies that were done on baby-friendly hospitals that followed the BFHI, work, and the maternal and newborn care in those hospitals were, much better as compared to non-baby-friendly hospitals, higher rates of initiation of breastfeeding, longer duration of exclusive breastfeeding, and total duration of breastfeeding. So
Yes.
who would think that if you actually have support for breastfeeding, that breastfeeding outcomes are better? Crazy.
Yeah.
Right. But yeah, so that's one of the best ones. I will say I have heard of some folks who have had negative experiences in baby-friendly hospitals. So I don't, as a public health professional, I think it's remiss to just act like everything is perfect, dandy, sunshine and rainbows. I think we need to learn from our pitfalls and do better. I've heard of some folks who they gave birth at a baby-friendly hospital. They went in, they already had a plan to formula feed, and they felt bullied in their decision. And I never want, that's not the point of breastfeeding. That's not it. You're not going to ever, just like some of my other work online, you're not going to bully people into getting vaccinated. You're not going to make, calling them stupid, telling them that they don't
that's not
care
going
about
to
the
do
health
anything.
of their baby. It's not ever going to change a health behavior. I think that just in general in public health, we have a lot of work that we need to do on communication with humans. So that's just a totally separate issue in my opinion. But yeah,
well,
those are some bright spots.
That's a great thing, because I used to work at a baby-friendly hospital, and I've heard the same stories of you, of these horror stories of people getting bullied and honestly just assaulted, of let me stick your boob in your baby's mouth when they don't want you anywhere near them. And I think it's really important for us to talk about those things, because you're right, these public health interventions and these policies are good, but they also can be better. And this is one of those that is good, but could be better. And a lot of it kind of stems from the idea that the hospital has these metrics that they have to follow. And if they aren't following these, they're not doing what they're supposed to do. And so for me as a lactation consultant in the hospital, if I had somebody who was formula feeding, I had to chart on that person to say I educated them about breastfeeding. I would go in and I would say, I know that you're choosing to formula feed. I'm literally going to talk for 2 seconds and then I'm going to walk out. If you ever have any questions, you let me know, but I just have to chart that I talked to you. And that is literally it. I want you to feel encouraged and supported in how you choose to feed your baby. I'm not trying to convince you.
And I'm telling you right now, Rebecca, that kind of interaction might make someone more interested and willing to have a conversation about, maybe I liked her. I feel like I trust her, and maybe I'll try just, if I can feed my child once a day, we can make it work, from
well, and that's what ended up
or something,
happening.
That's
And I
saying.
had some
See?
people who were well, I mean, I'd be interested to try, because I would talk, breastfeeding has immune reactions. It can help you keep your baby healthy, that kind of stuff. And then I'd just be like, all right, I'm out unless you have questions. And they're like, well, actually, I didn't know breastfeeding did that. Can you show me a little bit, talk to me a little bit more? And it kind of opened that question. But when you go in as a bully and you're just bulldog in of, we're going to breastfeed, it takes that choice away from the person, the autonomy of the person. And
for sure,
so much in birth right now is taking that autonomy away from birthing people.
And this is it's really important again to recognize pitfalls in public health. A lot of early public health interventions were not great in terms of how Black women were treated and basically experimented on in order to have some of the information we have today on public health.
Yeah.
in healthcare. Unfortunately, a lot of our medical systems are built upon a foundation of medical violence. So I
Yeah.
get why people have mistrust of the medical
Yeah.
field. And we
Yeah.
have to acknowledge that and do the work to restore trust and show how we've learned and are
Yeah.
not going to perpetuate these violent systems,
Yes.
which
Yes.
again, as you stated, they are still present to this day
Yeah.
because
Yeah.
it's very sterile in some ways in terms of
Yeah.
how people interact. And it's, people are, these are human beings, and it's
Yeah.
not everything needs an intervention,
Yeah.
and I think
Exactly. A little bit of this, but like what
yeah.
policy would you love to see in the public health to help promote breastfeeding and families?
Yeah, so I think it's something I touched upon earlier is, more legislation for protecting families from aggressive marketing of breast milk
Mhm.
substitutes, kind of helping the US move towards an adherence to the code,
Yeah.
perhaps making formula a public good
Hmm.
versus a commercial, item.
Oh, yeah.
I think, obviously paid parental leave for both parents, if that, is applicable to your family situation. I have seen babies at work programs making that something that is more robust, even in sectors that have, for example, one of the first ones in my region, they're called Badger Balm. I don't know if you've heard of Badger. They have kind of like natural based like products like
Oh
sunscreen
yeah.
and stuff like that.
Yes. Yes.
Yeah,
Yeah.
they're
Yeah.
they're over by me, and they're lovely. But they it's a, there's parts of that job that's factory work, and it just they have systems in place that allow for adequate, somebody is helping watch the child. They're allowed to bring a child to work up to when they're crawling, pretty much. And then that's when we start to think about, putting them into some sort of childcare situation. And anyway, if we can make that more robust, for obviously there's some professions that would be hard, like you can't be like a surgeon and having a job
Yeah.
like that necessarily. But being able to bolster that type of work in settings that can, have that, ensuring that we have affordable
Mhm.
childcare, because it's just another point of lower financial stressors on families to be able
Yeah.
to access what they need in terms of support for lactation, and making the baby friendly hospitals more robust and more sensitive to you know uh, having tough conversations with families instead of being
Yeah.
aggressive. Things like that could be implemented. I'm sure there's more. I don't know if you have any ideas.
Yeah.
I'm sure
No,
you
I
have
love that.
plenty from
Yes,
your
I
work.
do. One that I would love to see, which this again, kind of, I mean, it's public health, so I'm gonna still say it. Um, one that I would love to see is like minimum security prisons or jails to have moms and babies stay together.
Yes.
And there's only like, I think when I did the research on it, and it's been a couple of years since I did the research, there was only like 11 facilities in the US who did that. But the rates of like, oh, I can't remember, it's not working, of the word of like the parents coming back in the system,
Oh,
recidivism.
recidivism. That's what
Yes,
it is. Yeah, yeah,
yes.
yeah.
That like was super low, and like these
Mm-hmm.
babies had and there's not a strain on the foster system.
Mm-hmm.
Like it just was like
I
I would
love
love to
that.
see that. I would love to
I
see that.
love that. Oh, and another thing I would love is for like there to be just lactation professionals being able to tap into some sort of, I don't know if it would be grant or what have you, but to help, alleviate the burden of cost, kind of like in a similar
Yeah.
way of childcare. It's something that
Hmm.
um, all of the burden goes on to the person who's seeking the care, when in reality, if we provide subsidies for lactation care
Yeah.
professionals, for childcare professionals, for the care community and networks, that would make it easier, because you guys and all of us
Yeah.
who are doing lactation work are getting living wages, and
Yeah.
can afford to be more flexible and offer things that we want, and know that the communities need, it would make it, so that we could go into areas that traditionally it didn't make sense financially to be able to go support.
Yeah.
So something like that would be really incredible too.
If there was one important takeaway that you would want like any policymakers or healthcare providers or families to hear, what would that be?
Yeah, I mean, I think it's just that, if we can promote, support, and protect breastfeeding, along with all of these necessary, robust policies, programs, and systems that make that possible, it's
Yeah.
just one of the most effective ways to increase the quality of life of citizens. So it just seems like a no-brainer to
Yeah.
support families.
One thing that you could say to the people who are watching this to understand about public health and how it affects breastfeeding, what would that be?
Um, Public health is something that is totally underappreciated and underrecognized, and affects literally all 24 hours of your day, from the time you wake up in the morning all the way till you sleep through the night. And breastfeeding is just one tiny element of, public health, and can make such a substantial impact on your family's health, on our country's overall health, and well-being, as well as the world, because of the lack of pollution and all of that from it.
Yeah.
So yeah.
I know. And I'm so glad that you touched on that because that was one thing that I like just I don't know why, but it never even crossed my mind of that. So I have learned so much during this little chat that
Oh.
we've had. I love this so much. Thank you so much for coming and sharing your expertise and your information. Like I'm just so grateful for you.
Oh, thank you for having me. And likewise, you brought up some really great points that really added to the conversation. Thank you for that,
Well,
Rebecca.
thank you. Yeah, absolutely.